right. So first, can I just have you say and spell your first and last name as well as your title, just to make sure everybody gets it correct?
Charlie, Charlie, Nelms, Nelms, and I'm Vice President Emeritus, Indiana University.
All right, thank you. So to start, when you look at the current vaccination numbers in the state, what do you think? How are you reacting to that? What are you seeing?
Well, I have two reactions. One, I'm encouraged that people are getting the inoculation, but I'm also hopeful that more people will make their way to a clinic or to a site and get vaccinated at the earliest opportunity possible. So I'm pleased to see so many people getting vaccinated, and I'm hopeful that more people will be encouraged by those who are being vaccinated and that they will do the same thing.
In January, you wrote about why you plan to get vaccinated. Can you talk, excuse me, can you talk a little bit about why you got vaccinated and why you chose to speak out and let people know why you were going to?
Well, I got vaccinated, first of all, because I had lost a brother to COVID. In August of 2020, I lost a brother. It's a very close and dear issue to my heart. I've lost an aunt and also a cousin, as well as several friends. So this is not a superficial kind of matter to me. It's very personal. And so that's number one. Number two, I wanted to be able to make an authentic statement to Blacks and other underrepresented ethnic minorities in the U.S. to encourage them to get vaccinated. Because I know that people of color are disproportionately impacted in terms of coming down with the virus on the one hand, being hospitalized on the other, and also succumbing to this dreaded virus. And so I wanted to use my platform to make that pledge and that commitment and encourage people to get vaccinated. And of course, had an opportunity to join forces with President Michael McRobbie, and we publicly got vaccinated together as a show of our confidence and to encourage other people to do the same. But as a Black man who has held numerous leadership positions all across the country, I do have a significant number of people with whom I have a relationship. And I think people need to hear from people like me about the importance of getting vaccinated. And I felt that I needed to demonstrate that personally, as opposed to talking about a theoretical concept.
One of the things that you talked about in this was some of the history of vaccines, specifically the history with Black Americans and vaccinations, as well as just healthcare in general. Obviously, this is a lot of concern for some people. What do you think the lessons learned from the history of this are? And do you think that any of that was missed when the COVID-19 vaccine rollout began?
Well, my sense is that history is real. No sense about it. It is real. Okay. And so what I try to do, and I encourage people to do, is to acknowledge the reality of that history, but not let that history stand in the way of you doing what you need to do, I need to do, we need to do in 2020, as the case was when I wrote the piece, or in 2021. And so history is very important. We can learn a lot from history. I think it was Malcolm X who said that of all of our lessons, history is best suited to reward our efforts. And so the history is real. We can't change that, but what we can do is to learn from it. And so I acknowledge the history, but I say to people, you can't get so caught up in the history that you don't do what you need to do in a contemporary kind of sense. It's real. If you look at the more recent history in terms of the water crisis in Flint, Michigan, with lead poisoning in terms of children. If you look at Henrietta Lacks, the African-American woman whose genes were used for cancer research without her permission. So you can, the syphilis studies at Tuskegee, those are real. Those are real in the lives of some people, many people who are still alive, family members who are still alive. So I want to acknowledge that history, but I don't want that history to keep us from doing what we need to do now.
When you look at the current efforts, whether it's from the state or from local health departments or even community leaders or people like yourself, do you think that there's anything that's wrong with the messaging or the way that they're trying to reach people? Or what do you see that's working that more organizations or community leaders should be doing?
So I hasten to add, and I want to be very clear about this, I don't see anyone doing anything wrong. I think that what we need to do is to recognize the reality that one size does not fit all. That's number one. Number two, that history for some people is real, including my younger brother who just got vaccinated 2 weeks ago. Can you believe that? Just got vaccinated 2 weeks ago because of a great deal of his own hesitancy. And of course, I didn't do anything wrong. His physician wasn't doing anything wrong. He was just a really skeptical person about the impact of the virus, of the vaccine, rather. Potential impact on him. So that was part of it. So the hesitancy is real. And so what we need to do, I think, and this is what I see happening throughout Indiana and around the nation, they use multiple approaches, taking leaders, whether the ministers, whether the physicians and healthcare workers, trusted individuals, and have them become part of the message. And one of the things that I really appreciate about the fact is that young people are being used in the messaging as well. And so I think there are certain people that older people like myself appeal to, but there are some other people who relate directly and quickly to young people. So I don't think there's anything wrong that we're doing. We just need to do more of what it is that we're doing, diversify the messengers. The message is the same, but we need to diversify the messengers, and we need to use an entire army of people, if I may use a military term, to help get that message out.
You talked a little bit about representation and using community leaders. You said young people as well, that people are using younger people to help with this messaging as well. Why is representation important? You also mentioned that hearing from someone like yourself is important for people. Why is that important? And how can, someone who's watching this or reading this later, what do you think that they can do to help be a part of this message and help encourage more people to get vaccinated?
So for example, by using younger people, I think it helps to authenticate the significance and the importance of the vaccine and availing themselves of it. Okay, so it's one thing to sort of hear someone talk about it, but if you have a young person who's 17, 18, 19, 21 years old who has been vaccinated, that person is going to appeal to persons, I suspect, and my nieces and grandnieces and nephews, this is certainly the case, they have a way of appealing, and they post it on social media, and they get that message across, and many young people on it. So it's a way of authenticating the significance of being vaccinated. Okay, and so I think that is the most important thing that we can get by having, as I said earlier, different ethnic groups, different age groups, different professions, so on and so forth.
When you look at where people and how people can get vaccinated, the resources available to them to go to a clinic to get the vaccine and where these clinics are located, do you see any issues with that? Or do you think that these clinics are spread out enough, that they're in these communities where people have that easy access to them? Are you noticing anything with like the location and the resources available?
So and I can only speak to the community in which I live. Okay. And I think that people have good access. And when I look at the location of the clinics, I mean, they're literally all over town, from Indiana University campus to our local healthcare, our hospital, you name it, the convention center. So people have had really good access. The various pharmacies on the west side of town, south side of town. So I don't think that is an issue in this particular community where I reside, but I do acknowledge and recognize that is a problem in some other communities, especially in a rural community like where I grew up in Arkansas. That is an issue for people there, or in urban communities where I have lived and worked before relocating to Bloomington. That is an issue for people in those communities. And so I think the idea, though, is to make sure that the clinics are distributed across cities and rural and metropolitan areas and so on and so forth, so people don't have to travel long distances. And that's one of the improvements that I have seen within the last 90 days, for example, and the pulling in of churches, for example. My sister attends a church in Memphis, Tennessee, where they actually administer the vaccine, okay, on 6 days, 7 days of the week at her particular church. And so I'm really pleased to see that movement that's spreading out of those clinics across metropolitan areas. But it continues to be a problem, especially for people who may not live on a bus route, for people who maybe live in a rural community and may not have an automobile. But I'm pleased with what I'm seeing happening around the country that I hear about on the news, read about, and that kind of thing. So I'm encouraged.
My last question is the question on everybody's mind, from elected officials to health department directors to just people in the community, is reaching herd immunity. How are we going to get this pandemic in our rearview mirror and move forward? And a lot of people have set goals. So for example, in Marion County, our new goal is to reach 50% fully vaccinated by the 4th of July. I know President Biden and other leaders have other goals as well, but our numbers, our vaccines are declining, and there's still this hesitancy out there. In your view, what do we need to do to reach these goals? And what are your concerns if we don't reach these goals?
So let me talk about this whole notion of herd immunity. I mean, based on everything that I have read and heard, interviews and so on and so forth, there's a big question as to the true existence of herd immunity and how it differs from one community to the next, one state to the next, one city to the next. So I happen to, I'm not a scientist, but I believe in the science. And so I'm not sure that there is some magic number, okay, that is going to somehow ensure everyone's safety. So that's the first thing I need to say. The second thing that I need to say is that I think what we need to do is to keep on, don't give up. We need to have goals. We should not have the goal as our little God with a capital, with a small G, okay? So we need to have a goal, but we should not be so driven by the goal. We don't use some common sense, and that we don't continue to focus up. We don't need to beat up on people, okay? We need to encourage people and talk about the advantages, okay? And one is regaining our freedom of movement, our freedom of interacting with our family and friends and churches and eating out. We need to talk about the positive message that's associated with getting vaccinated. So we just need to keep doing that and don't give up, okay? And we shouldn't confuse, we should not confuse a detour with a dead end. Okay.
My last, I just thought of one more question I wanted to ask. Someone who's watching this right now who still has this hesitancy towards getting vaccinated, they're not sure if they should or they shouldn't, they don't really feel like they have all the information or aren't sure if they should even trust it. What do you recommend for people? Where should they go? Who should they talk to? How should they gather correct and factual information on these vaccines to help guide their decision whether they're going to get vaccinated or not? What do you recommend for people?
So that's an excellent question. The first thing I recommend that people do is not believe everything they read. Just because they see it on social media, don't automatically assume that it's true. That's number one. Number two, talk with people who have been vaccinated and understand why they did it and the safety and the security, increased safety and security that they feel. I would say talk to your minister, talk with your physician, talk with your neighbors who've been vaccinated. This is not exact rocket science here, okay? This is very much an emotional kind of thing. The hesitancy is around an emotional set of factors, okay? And so we need to acknowledge that, but I would say have conversations with people, share your hesitancy, let them know. And so in that way, when they're talking with you, they can say, well, I had the hesitancy myself, as they would say to you, but I decided to do it because it gave me greater security, greater freedom, and a greater opportunity to really live the full potential that's out there for me.
Is there anything else that you wanted to add?
The thing that I want to add is that first of all, I think across partisan as well as religious lines, I'm happy to see the quick kind of availability of vaccine. And I think that this is an opportunity for us to engage young people in conversations about health disparities, talking with them about the potential pursuing careers in STEM disciplines, and helping them to understand how they can be the change that they wish to see in the respective communities in which they live, they worship, and go to school.